Welcome to our Mailman Center Grand Rounds. So I think, as you all know, we always take the November Grand Rounds and the December Grand Rounds and squish them together. And we asked Dr. Armstrong to come and talk about sort of the state of the Mailman Center and what are the things we're doing and where we are. If I were to go through his CV and list of titles, it would take about 20 minutes. So we're not going to do that. I'm just going to tell you a couple quick things. First, as you all know, he's trained as a psychologist, has done research, direct clinical care, teaching. He's done all the things that we would ever ask of an academic physician, and now has been in leadership role the last 10 years at least, school level. Here's the story you need to know to understand why Dr. Armstrong is such a great leader in the midst of all the madness. So I don't know how old he was when this happened, but he was a young person and found himself surrounded by bumblebees. So these bees are all flying around him. And what would we all do if surrounded by angry bees? Run. And this is what Dr. Armstrong did. He quietly walked away. And the bees were like, okay, I guess there's nothing here for us. And I think that ability to sort of just stay calm and move forward quietly in the midst of chaos is probably the best thing that brings him as our leader. So please join me in welcoming Dr. Armstrong.
I'm not telling Jeff any more stories. And they were hornets. It's bad when you have to be introduced. I really should be one of those people who needs no introduction, but thank you. This is something I really enjoy doing every year because it's an opportunity for all of us to sort of take stock about what we've done in the last year. And then think about where we're going next. And so let me run through this. It's really tough. You say you never want to be the speaker between something and lunch. Well, the speaker between us and the party. And it's really, really bad news today. We came up with our vision statement a few years ago, improving lives through innovation, impact, and connection. And, you know, it's a stroke of brilliance. I never really got into mission statements and vision statements because usually what you did was spend 6 months trying to decide whether it was ob, in, or for, and arguing about a word. But this one has come up, and since we've developed it, it has become the measuring stick for all the programs that we're doing and the things that we're trying to think about doing. And it's so good that I've now had 2 national organizations wanting to know if it's copyrighted and if they can take it. So our mission statement exists for a long time. The really important components are interdisciplinary collaboration, cultural competence, family-centered perspective, integration, and addressing, developing, and identifying and integrating and educating. And if we keep those things in mind, that helps to really define the way that we do our activities. I wanted to go through where we are as a center in terms of some key metrics. And these are important. These come from the report that we send every year to the Administration on Intellectual and Developmental Disabilities as part of our USAID grant. We've been tracking them, but they give us an idea of what's happening. We have this year just under $24 million of leverage funding across all of the work that all of you do. We've had significant amount, just shy of $50 million in local and foundation support. We've had some really significant state support. A lot of our state support has come from Children's Medical Services, Early Steps, and the Child Protection Team, as well as a variety of other kinds of funding that have contributed to what we are trying to do. Our federal funding is hovering around $5 to $6 million a year, which is pretty good, but that's a metric that I really hope that we'll be able to see. The impressive total is that over the last 6 years, we have leveraged $144 million of funding from all sources, and that's really an incredible number for a center. This is our organizational structure that we came about a couple of years ago. I put it up just as a reminder. This was when we made the decision, not always comfortable, to move away from siloed disciplines and really make a commitment to interprofessional collaboration across everything that we do. And I think from everything that I'm seeing, it's really paying off. We're getting new funding. We're having good projects that are initiated. There are synergies that are happening within our IPCs, and it's a very exciting approach for us. We are continuing our training. This looks like a horrible slide because it looks like we're losing trainees over the years, but we made some specific decisions a few years ago with Lind to really focus and concentrate some of our long-term trainees. These are only the long-term trainees. The short-term trainees who are here for shorter durations of time, still we see somewhere, we're training somewhere between 50 and 60 here. And so we're really looking at about 120 to 150 trainees in various graduate programs who are touched in one way or another by our program. And I always look at the role that we have as teachers and educators. I can see one patient. If I train four students to see patients, then I've just multiplied what I'm doing by those four. And if each of them, even a couple of them, go on to be teachers, in a very short period of time, we're having this impact that is huge coming out of here. And so the training initiatives that we have at all levels is really essential to where we're going. We've struggled with the concept of what should our role be in terms of clinical services. We do a lot of training in how to be a health professional in various disciplines, and it really has been important for us to see a lot of patients and provide a lot of direct care. And this last year, we have provided care to just over 14,000 children across all of our various programs. What's really impressive of that is that you're really looking at almost 80%, a little over 80% of those children being of minority background. And that puts us in a class apart from other centers like the Mailman Center around the country and even around the world. And that commitment to that group of children is really a phenomenal commitment. Doesn't help us much on clinical revenues, and there are issues that we'll have to struggle with as we go forward because, unfortunately, the reimbursement for developmental and behavioral services for children under Medicaid and even under commercial insurance is really limited. And it's hard to make a living. We've looked at if we use Medicaid as the sole source, we'd have to take a loss of about 30% every time we saw a patient, and that doesn't really work. But we're going to be looking at some really nice, innovative strategies in the future, working closely with Barbara Coffey and the group from Child and Adolescent Psychiatry here in the Department of Psychiatry about some innovative ways to better do evaluations to provide broader impact, perhaps even developing some new training programs in some of the services that can utilize in a more effective way master's level trained providers as opposed to doctoral level providers for a number of things that we do. And we're hoping that those kinds of innovative solutions can help us to be able to provide that service and actually operate it without going into a loss. We do a lot of work in community and training and technical assistance. The numbers are there. The thing that impresses me tremendously, our goal, our 5-year goal for continuing education that reaches out to folks in the community and folks who participate in our program is 10,000. And this last year we touched 18,000. That's a really phenomenal number, and that comes in a variety of different strategies that we have. We're developing, thanks to a work of a lot of you and Ruben's work, we're developing an archive presence on the web, and that is really starting to to provide access to people who can't come to a meeting or actually interact with us personally. Again, our 5-year target was for 2,000. This last year we had 6,490 who participated. So maybe our goals are too low, or maybe we're overperforming. But either way, it's a really nice thing for us to be happening, and I'm very proud of that. Our research initiatives are actually going along fairly well. This is 2017-18 on the end. We had 16 new research projects that were initiated by our faculty and staff. We had 36 ongoing projects. We had 33 submitted for funding and review, and that's nice. If we look at pay lines and the like, you have about a 20 to 25% chance of having funding. And so if you only submit one grant, you've only got a 20% chance of having that one grant done. But if we've got 33, we begin to have the chance to maybe 6 or 8 of those are going to be funded. And as we get better and better, that number goes up. So we are submitting really nicely, and we're still participating in a number of multi-center grants in collaboration with other institutions. And this is an area I hope we can continue to see improve. The important thing that we have is outcomes, and some of those are how are we doing in terms of funded projects, how are we doing in terms of publications, and what about presentations. And our total number of projects is down this year. The publications were really a surprise to me. I think we may have had some data miscounting, and we're going to go back and dig into that, because our publications this year were about a quarter of what they usually are, and I'm not sure what we missed, but we'll have to tackle that piece. But that's an area that we really want to make sure we have high hit. It's important to write about what we do, because nobody knows about it unless we do. And when we write about it and it's good quality work, then people cite it. And that's really what we begin to see here, are the number of times that work by our faculty and staff and publications have been cited by other people in their publications. As you can see, it's close to a little bit over 500 citations this year, and that's our highest ever. And this is like citations in publications from 3 years ago. So we're going to continue to look at that, because that's a real measure of impact in the dissemination of the work we do. When you ask somebody on our campus, what's the Mailman Center, they'll say it's that building over there. Or they'll say, oh, it's a part of pediatrics. And those are true. They're very true statements. But the Mailman Center was the second center of the University of Miami. And that means it was designated by the Faculty Senate and by the Board of Trustees as a university center. We're actually, at this time, we're hopefully going to not have this position much longer, but at this point we are the only federally designated center at the University of Miami, and we're designated in statute in the Developmental Disabilities Act of 2000. The reason I say I hope that that's not true, I'm really hoping that the Sylvester Cancer Center gets NCI designation. We've been working hard, a number of us have worked hard to help them with that. But when we think about our role as a university center, it's very different from being a division in the Department of Pediatrics or a building. And that is, we have to work across multiple partnerships and serve as a matrix center that builds synergy and helps not only our department to grow, but other departments. And this is a great slide. These are the departments and schools at the University of Miami that we currently have active relationships with. And that's pretty impressive. I would push many other non-federally designated centers at the university to put that through. One of our major initiatives with our redesign a few years ago was to go to this concept of interprofessional collaboratives. We have 5 of them, and at this point in time, as I go through the high points of what's happening here, I think you'll come away with the impression that at least 3 of our IPCs could probably be standalone USEDs comparable to others in the country. And that is a phenomenal achievement for us. When we look at the Promoting Behavioral Health IPC with Jason and Julieta as the leaders, this is, and Jason, Julieta, forgive me, all of you IPC leaders, I really kind of consolidated goals, but I think we're close, and if I'm wrong, throw something at me. But I think the primary goal of our Promoting Behavioral Health IPC is to develop opportunities for integrated evidence-based behavioral health care, and to have that focus on families with disabilities and challenges. The group has been really phenomenal. We have 5 new active IRB protocols. There were 6 grants. 3 of those were new this year, 17 publications plus a white paper coming out, so active in all of those impact areas. We have multiple clinical programs. Certainly the largest is the Parent-Child Interaction Therapy, PCIT, but there's been a real nice development in the trauma-focused cognitive behavior therapy and active integration in the school health program. A number of things that have been happening here. I love the initiative, the innovation that this IPC has done in developing online professional development opportunities. And that's a way to make sure that people who aren't close to us have access. And this is an area that I really hope we are going to develop more across IPCs for all of the centers. And in these little boxes on the side, you're just going to have to run with me. And there's a couple of them that I even had to put dots because the boxes weren't big enough to put all the connections in without going to a font that was so small I couldn't read it or edit it. But this is a great example of 15 or 20 organizations in our community that this IPC is actively working with, and Jason and Juliet, I think we probably left a few off the list. And importantly, these are tied to those communities of partnership as part of our priority. And I wanted to make the list for each of the IPCs just to give you an idea of how many people are actually participating, sometimes actively, sometimes not actively, in the IPCs. And one of our initiatives for the coming year is going to be to continue to look across the university to see, are there individuals who really should be part of our IPCs, given membership in the Mailman Center, to expose and expand the breadth of what we're doing. But this is pretty incredible. And I made a decision not to list degrees or not to highlight who was faculty and who was staff and who was trainees, because this is really about all of us coming together to work on things. But this is an impressive group of people who are doing some really great stuff. The second one is our Community Health IPC with Ruby and Maite as our leaders. The goal here, again, I simplified it, is to build capacity for improving children's health in our community. And again, the research, 3 grants, 2 of those new and a continuation, 4 submitted or under review, 7 publications, 4 under review. Now, we know we got $15 million from the Children's Trust a few weeks ago. That's not a bad thing. Not a bad thing at all. That'll help next year's funding numbers look really good, Ruby. Thank you. But we clearly are seeing that kind of growth in getting external funding and starting the process of writing about it and having it disseminated. Our early discovery program, Jumpstart, and WIC initiatives are providing services around nutrition and healthy behavior to probably 700, 800 children at this point. And that's a big impact. I hope that we can continue to build that capacity because we know there are many more than needed, but the models are there and are important. Certainly, we've had a number of things in training. I did want to point out that one of the things that this IPC is really working on is the development of an health training program. And that is a critical start. If we think about the foundations for adult health in a variety of different areas, whether it's a disease like cancer, or cardiovascular disease, but also health and well-being. Much of that starts in that period of time before the 5th year of life. And so being able to focus on infant mental health, when I heard it the first time many years ago, I had this thought of, a baby laying on a couch, but it's evolved a lot from that concept. And we really are looking at now an evidence-based approach. And for the community health IPC, this is one that needed the dots in terms of all the people and all the organizations that we're connecting with. And again, a really impressive group of people, not just from the Mailman Center. I really want to emphasize this point. As I went through putting this presentation together and looked at where people are coming from, they come from all of those circles that were in the earlier dot. And that is a phenomenal statement of the impact, the degree to which people outside our center buy into the concept of what we're doing, and our ability to welcome and integrate those individuals. Our neurodevelopmental intervention science IPC with Michelle Berkovitz and Lynn Miskell, again, the goal is to develop capacity for enhancement of early social emotional development, communication, and literacy. Critical developmental skills for all children, particularly those with a developmental challenge. They have 5 protocols open, 11 grants, 2 publications, 2 under review, and there were 14 poster or oral presentations this year. Lots of different projects here, and I'm going to mention, we know about our Early Steps program because it's core and central to what we do as a center. The Early Discovery program funded by the Children's Trust has been something that's been really critical in helping us to understand those children who are at risk but not necessarily meeting criteria for intervention and what happens to them, and helps to inform what we need to do better in the early years. The Debbie Institute is the stalwart of our core programs and internationally recognized for the work that we've done there. I did want to hit some that we kind of forget because they're often not in this building. They're out in the community. But our Families First program with Connie Morrow and Ilana Mansour, that was the first program funded by the Children's Trust, and it has been continuously funded since that initial funding, and it reaches out and does triaging in the community of children who or parents who are at risk to abuse their children, and then provides different levels of services to help with that prevention. And it's done in churches, synagogues, YMCA, community centers. It is clearly a center-based, or not a center-based program, but a community-based program. The Jasmine Project is a HRSA-funded project with an incredible goal that fits with us, and that is to address ways with women, African-American women, who have infants, and to do things that prevent the death of that infant before the first year of life, because African-American children are at significantly higher risk of dying during the first 365 days of life. And that project is focused on a life and death initiative, as is the program for Starting Early, Starting Smart. So we've got a huge clinical impact coming out of neurodevelopmental intervention, as well as a number of projects at the Debbie School. The FAST program certainly is a major component with our assistive technology initiative. Michelle has added the Step Up AT grant from the Department of Education from OSERS, and that is a major initiative to look at ways to use assistive technology to increase literacy and communication skills in children with developmental disabilities using technology. We're really excited about that. We got lucky this year. I did want to point out one thing. Everybody else related to the Children's Medical Services has been taking cuts, and I thought we would get another cut in our grant this year, and they called and said, you know what, we want you to take over the evaluation component of the Early Steps program in the state, and they increased us $100,000 without being asked. So we're working on that, and Dr. Batya Elbaum has joined our Mailman family, and she's helping us with reviewing the child outcomes data, doing the reports that the state needs for that. We'll be doing focus groups with Early Steps programs across the state this spring, looking at a survey. It opens up an opportunity for us here at the center that we'll be developing, which is to create an evaluation core that allows us to be the place that programs like the Children's Trust or United Way or Early Learning Coalition or Health Foundation or the state of Florida can come to for putting together those kinds of evaluations, because we need evidence to know that what we're doing is actually working. And again, this was one of the dots for all the, there's another half a page or more of the folks that they're working with. And again, an incredible group of folks who are working with this IPC. Our neurodevelopmental discovery is our really basic clinical science component. This is where we're looking at discovering how things, what are the mechanisms behind the disabilities that we focus? How do those translate into clinical opportunities, and then what are the clinical trials that we can do with behavioral interventions, with new drug therapies if they're appropriate, and increasingly here as part of the school's overall mission to think about ways that we can explore gene therapies for some of the conditions that are coming up, something that's not part of our typical USET in the country, but a critical opportunity for us. We've gotten funding from a lot of places. This is Bob Pfeiffer and Dan Messenger providing the leadership in this area, and they're developing cross-university discovery science programs that optimize synergy and impact from our research. There are 11 grants, 18 publications this last year, 5 presentations, with funding from largely from the work that Dan Messenger has been doing from the National Science Foundation, but with funding from the NIH, from HRSA, from the Clinical and Translational Science Institute here, from the Florida Department of Health. One of the big initiatives that is a research and training grant is one that the Bob Pfeiffer has from HRSA through the LEND process that is establishing a health infrastructure in the U.S. Virgin Islands to deal with Zika. And I'm going to talk about that as a special piece in just a minute. And again, in this case, we're actually dealing with a strong collaboration with one of the U.S. territories, the Virgin Islands. Again, a great group of people. And this one, I would point out, includes physician researchers from otolaryngology, from biochemistry, from human genetics, from medicine, and across the board. And this is a really good place where we're bringing in, and I hope to see real expansion in this area, because this is the IPC that I am looking to develop the synergies that allows us then in the next cycle from the NIH to put in a strong competitive application to become an intellectual and developmental disabilities research center designated by the NICHD. So we've got a goal for this group to move that forward. I do want to talk a little bit about Zika, which we heard a lot about in Miami. We were very successful in putting together 4 grants to the Florida Department of Health, totaling $8 million. They included focus on neurodevelopment, clinical consequences of Zika in children, impact on hearing, and a neuroimaging component. We had Ivan Gonzalez, Emily Banstra, Dr. Pfeiffer, Nina Barakal from ophthalmology at Bascom Palmer, Dr. Segal from radiology, and Dr. Yunus from otolaryngology, who are all collaborators in putting together these independent grants. And then that group of investigators worked very hard to combine those independent grants into an integrated, almost program project with shared protocols. And unfortunately, This was a governor's initiative, and the legislature didn't agree to provide the funding in the second year, so the grants ended after a year. But the group is continuing to work on that whole idea of putting together a major application to the NIH to support the Zika research. Zika will probably go away as a major health issue, but there will be another mosquito-borne viral illness that we're going to have to deal with here. Importantly, Bob was able to get the funding from HRSA and working with the Virgin Islands, and they're developing an infrastructure for integrated care for Zika-affected individuals in the U.S. Virgin Islands. Involves a number of clinical components. So far, they've looked at over 2,000 children for initial and about 1,400 who have had follow-up. 203 of those children had Zika-associated birth defects or neurodevelopmental disabilities. And so that's a really high rate. And there are some very interesting things that are coming out, particularly in the hearing area, where children may not have hearing loss and then may have acquired hearing loss later. They may have initial hearing loss that disappears and then comes back. There's some really interesting pieces, and the effect that's going to have on language development and how it's tied to other areas of neurodevelopment is going to be an exciting area for us to be a leader in. And our lifespan IPC, the goal there is to develop innovative solutions for challenges, of older adolescents and young adults with IDD and chronic illnesses. And this is a slower starting IPC. They have one IRB approved protocol, and they did two presentations. But they've been working really diligently with the Special Olympics to identify adults and better understand their healthcare needs. And there's now a lot of discussion going on with this IBC, and I'm really looking forward to it, to develop a novel model program for how to provide outpatient and potentially inpatient care to individuals with severe developmental disabilities. You think about going into your doctor's office and they say you need to have a shot or you need to have blood drawn. Well, imagine now doing that with a 25-year-old with severe autism or a severe developmental disability that has significant behavioral consequences. How do you draw the blood? And in many cases, these young people have to be sent to special services, or they don't get the bloods drawn. And so we're going to be looking at ways to create a model to provide that care. And Matt M. has been working with us a lot on that. And we've been having conversations with Jackson for the last few years about even creating a niche inpatient unit. It would include augmentative communication. It would use assistive technology and would have a highly trained group of nurses who could provide the kind of care that involves those patients with full participation in their care to the greatest degree possible. And fortunately, our ETLP class last year took this on as a project, and they're going to be working on that very nicely going forward. A smaller IPC, one that I hope to pick up, we fortunately now have the full support and I hope engagement of Dr. Roy Weiss, who's the chair of medicine, who has a particular interest. It's always good to have another chair coming together with us. I want to talk a little bit about our cross-IPC initiatives and some of the things that are going on that are really unique. Our leadership training pipeline is a bottom-up, and this is a complicated figure that really shows how we've taken disciplinary trainees, family trainees, and people with disabilities and brought them into our LEND program, and then we've had individuals who've gone on to our Emerging Transformational Leadership Program, the ETLP, and we are now working with our sister agencies in the state, the other USET in Tampa, the Disability Rights Florida, yes, that's the other one, and our DD Council, to identify individuals, some with disabilities, some in leadership roles, that can move to a state level to achieve really leadership in the policy area, and really excited about that process. This is some of the things that we've got. We started with ETLP a number of years ago. Folks nominated from the community to participate in our year-long program. After that, we were able to get funding for the self-advocacy leadership training. And Project SALT is going along really beautifully now with lots and lots of participation. In our ADD, or you said grant this last time, we put in a novel idea that was generated by our Mailman Advisory Council, and that was the Student Emerging Leadership Program, or SELP. And Shelley has been putting that together, and we've got folks from siblings and high school students who are interested in learning about leadership. And we really want to increase that and draw a number of participants from our affiliated communities in East Little Havana and Overtown as well. So we are, again, making sure that that leadership development actively engages individuals and high school students of minority backgrounds. And then I mentioned the next gen. So we've got this feeder pipeline. And I will say, Shelley and the team did a fabulous job at AUCD in an oral workshop presentation on this that generated tremendous interest from other USED and LEND programs around the country. The Taft Foundation funded our Family Navigator program. Now, there are Navigators programs out there for cancer. We've known those for a long time, but for everything we can tell, this is the first time we've put together a Navigator program for families of children with developmental disabilities. And it is supporting all of our Mailman Center programs, other programs here in the Department of Pediatrics, and is now reaching out across the School of Medicine. It's one of those things where as soon as people hear about it, they want to know, how can I get one? It's how can I be like Mike? And we've served 912 children since 2016. 53% speak English, 37% Spanish, 7% are bilingual, and 3% speak Creole. So it really does have large bilingual impact. And I just got an email from Nancy just before I came in here that we now have the brochures out and the support materials in all 3 languages. That's fabulous. And we're serving both children and adolescents and adults. And this is a phenomenal outreach program. Again, one of those things that's unique and innovative from what we're doing. We had a fabulous meeting at the AUCD back in November, and the reason for it was, look at all those people. Number one, they're really nice looking folks, and they look smart, and they're talented, and all of those things. But we've not had 22 members of the Mailman Center faculty and staff go to AUCD ever. And folks were able to, we had 7 or 8 superb presentations, and I had the great experience of walking around and having people stop me and say, "You guys are doing such good stuff." And it was a great thing to have happen. Our community outreach, I just put pictures because those tell it. We have so many outreach programs. Healthy Start, the Pediatric Mobile Clinic, our FAST program. Name them. And that's really important. We should not be within the walls of the center. We should be impacting our community. It's one of our large goals. We selected as a priority area the interface between disability and diversity. And that has led us to a number of very exciting things. Our Overtown initiative, particularly our partnership with the Overtown Children's and Youth Coalition, we participate in monthly liaison meetings. And we have PCIT at Touching Miami with Love. We have a partnership developing with Booker T. Washington School. We have participation in educational and strategic planning with our community partners. We just had one of those meetings in terms of leadership training here at Mailman this week. We have the early discovery and PCIT developing their impact in that community. And the goal, and I say this to the communities, was not for us to be the Mailman Center coming to take care of all your problems, but to come in and listen, to have those communities tell us what problems they had and which ones could we help them with and how could we help them. And then our goal is to help them build their capacity to deal with those. And that's a really important facet of what we do, because basically what we're saying is we're going to give away what we do. But I don't think there's anything better we can do in our communities. In East Little Havana, we have the Live Healthy Little Havana Screening and Engagement Collaborative. We have the Obesity Prevention Initiative, Connect Familias. We have the Promoting Behavioral Health Impact Team, and Project Womb with Julieta is going on there. And then, as I mentioned, the Jasmine Project to prevent infant mortality in African American babies in North Miami-Dade. So really important community outreach. I'm not going to go over a lot of stuff here. This is reference to the parts of our AIDD grant that refer to these initiatives with communities. We've also had and are continuing to grow our impact using telehealth and teleeducation with the Pediatric Mobile Clinic, the School Health Initiative, Early Discovery, PCIT, the Debbie School for Professional Training, Project Womb, the teleauditory verbal coaching that we're doing with otolaryngology, and the FAST program for coaching of teachers. A great platform for us to use. We've invested dollars in making sure we have the technology to do that, and we hope to continue to be a leader in this particular area. Just so that you can't say that nothing ever happens, the elevators work. They all look nice. Aside from some little glitches with the programming the first couple of days, I've not had an elevator failure. And the Debbie elevators are in progress for all of you who just took a phone call. We're going to get those taken care of. We've really moved our clinical record keeping to UChart. And Jason particularly is leading an initiative to help us develop an integrated background form across all of our projects that will help us get the information we need to provide clinical care, but also collect data that where we can do some research across all the services we provide. The Debbie Institute floors in the middle are finished. They look a lot better than they ever did before. It looks fabulous over there. And we'll be beginning Mailman Center lobby floor replacement this spring. They're just working on getting the right tiles. The Innovation Center on the 5th floor is completed. The furniture is in. We'll be having a grand opening of that. I think in February. It's going to be named the Tiffany Field Innovation Center. And for those of you who don't know Tiffany, she's one of our faculty. She has done some incredible work in the area of touch. Her work on infant massage revolutionized the way that babies in the neonatal intensive care unit are taken care of all around the world. And a few years ago, there was a senator, actually many years ago, named William Proxmire, who thought that we were giving away money for research that was useless. And so he came up with an award that he gave every year to research projects that were fleecing the government. He called it the Golden Fleece Award. Well, the NIH responded to that and identified individuals whose research had made significant contributions to the advancement and translation of science into benefits for human beings. And they called it the Golden Goose Award. And Tiffany is one of the recipients of the Golden Goose Award from the NIH a few years ago. And so we thought it was really quite fitting to name our Innovation Center after Tiffany. There will be some rules on the Innovation Center. You'll notice that everything rolls, and there's very little that's permanent. The walls are painted with a slate that you can write on them and erase them. And you cannot go in there and talk about problems. This is a place where you come up with solutions and new ideas. And so we expect that this will be a place where you just need to come in and think, or get a small group over in the corner, and we will see our innovation take off.
It's on the 5th floor, right?
It's on the 5th floor. Over in that corner, the big room, like the training room on the 4th floor. We've got a number of things. We're in the middle of a relocation of all of our clinical services onto the first and second floors. We've done a lot of renovation for a lot of the clinical medical services on the first floor. We're going to be doing renovations of the second floor to be able to better utilize for our behavioral and developmental services. And we've begun to see the movement of other departments, clinics into the Mailman Center. Neurology's moved in, surgery's moved in, and that gives us another opportunity to have integration between what we're doing and what they are doing. So that was that. So again, our driving principles for change, innovation is to do things differently, lead rather than respond, to have an impact that makes a difference not only at the child and family level, but at community and population levels through policy, and to focus on developing and strengthening those connections, because by doing things together with both historic partners and collaborators, it really helps us do things in a way that has high impact. Now, I'm not going to go through the details on these slides, but I do just want to point out a couple of the opportunities that are there for us in the future. We continue to address health disparities at the intersection with disability, and our work in Overtown and East Havana is crucial to that effort. But I do want to point out that our long-term vision is not to stay in Overtown and East Havana. Once we've helped to build that capacity, then we want to partner with another community so that we help to build the capacity all across the county. We want to build service capacity in our communities, not so that we don't have to be this provider of all the services, but we can help the communities provide the services in the best way that we possibly can with the best outcomes that they have for the children. We want to continue to develop a research mentality around our service programs. At the AUCD meeting, I had at least 2 conversations with some of our folks that were presenting our really nice service models about how do we collect data, how do we evaluate those, how do we make those things turn into publications that other people can read about and utilize in their facilities. That's going to be a critical piece. We want to make sure that we promote innovative approaches to the unmodifiable social determinants of health. Just because someone is poor doesn't mean that we can't find a way to help, and being able to learn those new approaches is going to be critical. We've got some next steps. Improve the efficiency and efficacy of our clinical programs. Improve the collaboration and integration with other programs across the university, develop strong translational relationships with other centers and institutes, and really for each of our IPCs, develop a process to put the building blocks together so that we can plan toward things like an IDDRC center out of NIH and a similar kind of center approach or program project approach for each one of our IPCs. NIH funding for that kind of thing is the gold standard. It's the coin of the realm, and it's the thing that makes us at so many levels not only great for all the things that we're doing, but comparable to the cancer centers, the diabetes research institutes, the Bascom Palmers of the world. We need to continue to expand our core service programs, the Debbie School, Early Steps, the Child Protection Team, to serve as platforms for innovative, high-yield research, develop a strategic and synergistic research program across IPCs that is inclusive of all levels of translational research, and be intentional and effective in translating the really good ideas we have out into community settings so that they can be employed broadly. Bottom line is that the world of developmental disabilities, children with special health care needs, and child health in general has changed and is going to continue to change. We can be reactive to this change, or we can be the leader in how to use this change to improve lives of children, their families, and the communities that they live in. Because the final thought, and I'll use this one every year because it hadn't changed yet, if we embrace innovation, if we strive for impact, and we achieve success through connections, it's really kind of simple, and that's what we're all about. Now, I do want to take just a second to say a thank you I think many of you know this was a personally challenging year. And I want to tell, Jeff told the story about me standing on the hornet's nest. I want to tell another story. Last New Year's Eve, when I was lying in the hospital and they were doing the test, and we realized there was a really good chance I was not going to come out of that surgery. You think about things that are important to you, and of course I thought about my wife and children and family, but I thought about the Mailman Center. And I have to tell you, I didn't worry about it, because for about 1 minute I thought about the Mailman Center, and then I thought, we have done the right thing. And if I don't come out of this, we've got the leadership, we've got the momentum, we've got the enthusiasm that what we've put into place was going to go on whether I was here or not. And for that, for all your well wishes and everything else all the year, but for that more than anything else, thank you, because that's what makes it really my honor and privilege to serve as your director. Thank you. Questions? Jason, you're going to keep us from the party. But
I am. The foot's out. Real quick. Maybe it's not quick. Maybe we'll just ask you separately. But I mean, if it's too long, we can talk about it separately. Is the notion of what are, I think, as IPCs or as the Mailman Center, we should be establishing what those benchmarks are in Overtown and Little Havana, so we know once we've kind of built the capacity or helped in the way that we think we can before we make that. 'Cause you could go on forever in those communities, and just maybe that's a goal for us for next year, is to try and figure that out.
Jeff, you want to comment on that?
Just one quick part of that. So we recently have recruited a Master's of Public Health student who has expertise in program evaluation along with their faculty, and we're beginning work with both some of our partners in Overtown and Savannah, but also looking at the larger data sets across Miami-Dade County to get a sense of what's been happening over the last 5 years, and so we can start thinking more concretely about that. And part of it, you may recall, in the ancient history of IPCs, we did ask you guys to think about what are the markers that you would want to say. So for, is it children are at a healthy weight? Kids are graduating high school or have a plan for what to do afterwards? In helping us think about, well, what are the things your IPC would say, yeah, here's a public health marker. We want to say, yeah, we're aiming towards that. Because you're right, we could go on for a long time. I think a lot of it too is, and my team's doing this, when those communities are able to write their own grants, have their own leadership, then we'll feel like, okay, it's time to move on. So it'll be partly numbers, but also partly capacity.
And we've actually we built into our plan for the youth said the use of some of the child health data, zip code by zip code, from the Children's Trust and others. And we've had conversations with Children's Trust that will continue about expanding the data that are collected. But at this point, there are some key indicators that we've included in our grant. Things like kids winding up in the juvenile justice system, kids graduating from high school. Some indicators that are already built in that we'll be looking at. Now, those are 5 and 10 year out kind of indicators, and there are certainly other process pieces. So, Jeff's point is this is an area. When I mentioned what we're doing with CMS with early steps, that's another area for really thinking about and finding the way to develop a measurement core for program evaluation. You're absolutely right on target. Good. Other questions? All right, thank you all. Let's go party.